What about, and I don't know how you feel about this, what about home remedies for cold? Also, what do you think about the vitamin C and echinacea, the stuff that people have been recommending?
Well, echinacea and vitamin C and some of these other alternative therapies, the results are inconclusive. In some studies, they may have shown some benefit, some others not. The dosage and how to do it is not very clear. Mm-hmm. So in general, it's probably not something that's going to help very much.
Okay.
I have heard of some studies with vitamin C where they thought it might decrease the duration of illness, but that was if you were taking it like ahead of time before your cold started. Mm-hmm. Not something you took as like a treatment, like when you started having cold symptoms.
Okay.
So most of those things, even zinc, you didn't mention that, but that's another common thing that people use. But the studies are inconclusive, particularly in pediatrics, in kids. Okay. We really don't know if they help or not. Mm-hmm. And some studies have shown one thing, some others. So it's just really kind of up in the air. We don't know. Mm-hmm. But home remedies are, depending on what it is, are fine to use. Mm-hmm. Things like maybe humidifier. Mm-hmm. You mentioned steam baths. Mm-hmm. Those things are fine, and if you're seeing an improvement, they're fine to continue. Mm-hmm. Saltwater gargles are good for sore throat or inflammation. Mm-hmm. But any of those things are fine, but it depends on what it is.
Okay. Honey is like a big one, right?
Honey is fine. Actually, they've had studies on honey showing that it helps a cough. Mm-hmm. They had studies showing that they improve nighttime cough as reported by the parents. Mm-hmm. So there are some properties. We know honey has properties for antitussive or cough, helping a cough, and it has some antibacterial properties also. Mm-hmm. So honey is one thing that has been studied a bit, and there are some things that we have seen improvement with honey. Some of the other ones are not as conclusive, though.
Mm-hmm. Okay.